Good afternoon, everyone. I'm Jason Brown, County Administrator for Indian River County. I want to give a brief update on the coronavirus and where we stand. First of all, I want to assure everyone that our number one priority is the health and safety of all the residents of Indian River County. With this mission in mind, officials from all local governments within the county, including the cities Vero Beach, Sebastian, Fellsmere, the town of Indian River Shores, and the town of Orchid, have been in contact with each other and working around the clock to ensure the best combined response to the coronavirus. We've also been working with the health department and all of our emergency management partners on this event. I want to remind everyone there are a lot of questions out there. I would encourage everyone to go to use the county's Emergency Information Center, which is currently open and will continue to be open from 8 a.m. to 5 p.m. 7 days a week. This information hotline is staffed by county employees, and they are available to answer questions related to prevention measures for coronavirus, healthcare facilities, travel guidance, and more. You can reach the EIC by calling 226-4000. I want to talk a little bit about social distancing and why we do it. Just going to start out with some words from the president from Monday this week, or Tuesday this week, I'm sorry. The president says, and I quote, "Our country is in the midst of a great national trial, unlike any we have faced before. We're at war with a deadly virus. Success in this fight will require the full absolute measure of our collective strength, love, and devotion." Goes on to say, "Each of us has the power through our own choices and actions to save American lives. Each citizen is being called upon to make sacrifices. Every business is being asked to fulfill its patriotic duty. Every community is making fundamental changes to how we live, work, and interact each and every day." So I just kind of want to reiterate those words and talk about the importance of social distancing. There are many models out there, including the ones released by the White House earlier this week, and these models are projections. And some of those models have higher statistics and others have lower statistics. The thing that is different about, say, a weather forecast from this is we have the ability to control those numbers. And what social distancing and these actions that we are recommending will save lives. They will reduce the number of people that get sick. They will reduce the number of people that have a bad outcome. So that is why we're asking everyone to honor these the social distancing guidelines and follow the governor's order. I want to thank Governor DeSantis for his leadership in the Safer at Home order, which went into effect at midnight. Folks may have questions about that, but I think the key answer is stay at home if you don't need to. Only make essential trips. That's what it boils down to. You can do that for work and essential business, pick up groceries, pick up your medicine. If you have questions about that, there's information on the county's website, which I also would refer folks back to. That is at ircgov.com. So please go to that website for all of your questions about the coronavirus. You can also receive updates by following us on Facebook and Twitter, and you can sign up for our web alerts at alertindianriver.com. So just want to reiterate social distancing, stay home unless you need to leave the house, and remember that our collective efforts are what is going to reduce these numbers and turn these numbers around. So I would recommend that everyone do that. So that's all for me. Now I'm going to turn it over to Miranda Hawker from the Department of Health. Thank you.
Thank you so much, Jason, and I appreciate you emphasizing the social distancing. So statewide, as of 11 o'clock this morning, there are 9,585 cases with 1,215 hospitalized and 163 deaths. Our current number of cases here in Indian River is 44. 17 of these are travel related, 19 had no travel history, and 8 are still under investigation. We have 7 people that are currently hospitalized. The age range of our cases is from 8 to 88, and we have 26 men that have been infected with COVID and 18 women, 0 deaths. All of our cases are self-isolating or isolated at the hospital. I want to urge all Indian River County residents to stay home and only go out for essential trips. I want to stress how COVID-19 spreads. It spreads person to person, between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouth and noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Maintaining good social distance, about 6 feet, is very important when we're talking about preventing the spread of COVID-19. Washing your hands very frequently, or using, if soap and water is not available, using hand sanitizer. I want to stress cleaning those frequently touched surfaces. It all spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their eyes, nose, or mouth. It's not thought to be the main way the virus spreads, but we're still learning more about the virus. Some other information that has just come out from the CDC in terms of the virus spreading very easily and sustainably between people. How easily that virus spreads can vary. Some viruses are highly contagious, like measles, while other viruses don't spread as easily. Another factor on whether the spread is sustained, which means it goes from person to person without stopping. We currently do have community spread of COVID-19 in Florida and within Indian River County. Information from the ongoing COVID-19 pandemic suggests that this virus is spreading more efficiently than influenza, but not as efficiently as measles, which is highly contagious. Everybody should be paying attention to their symptoms. They need to stay home if they're sick. If you have symptoms of COVID-19 like fever, cough, or shortness of breath, make sure you're calling your healthcare provider before coming in the office so they can evaluate you. Again, if testing is determined to be needed and meets screening criteria from the Department of Health, drive-through testing is available at Cleveland Clinic and Indian River Hospital. The health department is also providing that testing on a limited basis. Currently, the health department has 150 test kits. The State Surgeon General issued a public health advisory directing all individuals over the age of 65 and any individual with high-risk conditions to remain in their residence and take all measures to isolate themselves from risk of exposure to COVID-19. So those people with underlying conditions like diabetes, chronic lung conditions, or cardiovascular disease are at higher risk for severe disease. I also want to tell you that the Florida Department of Health in Indian River has signed up to the Nextdoor app. That's new, and we're posting updates to that app. We're continuing to send updates to the medical community and our community partners. We have our local call center at 772-794-7411 from Monday through Friday, 8 to 5. The Department of Health at the state level has a call center in place 24/7. That number is 1-866-779-6121. And at this point, I'd like to turn things over to Corey Richter, who's going to give you a report on the hospitals.
Thank you, Miranda. Both hospitals now are severely restricting visitations, and I encourage you, they kind of gave me what the restrictions are, but I encourage you to go to their website and see what the current restrictions are, because they could change on a quite regular basis depending on the outcome of this, as this COVID-19 progresses here. SebastianRiverMedicalCenter.org is Sebastian's website, or IndianRiverMedicalCenter.com for Cleveland Clinic. So I encourage you to go to their website if you want to visit, because they are severely restricting visitations to protect the patients and their staff. Sebastian is also prepared. They haven't seen a surge yet. We haven't seen a surge in either hospital yet, but we are prepared for it. Both hospitals have been working daily, meeting daily to be prepared to handle the situation as it escalates. And both of them are ready to handle whatever comes their way. Hopefully, no. Sebastian has also implemented 100% universal masking for all their staff and providers in their facility, so that's for your protection. They've created a separate respiratory unit for patients of interest that are not positive yet but tested, so they can keep them separate from the rest of the patients and the ED and everything. So they're trying to do everything to quarantine people into certain areas before they find out what the results are. And if things start getting worse, they have a medical tent that they'll have set up to handle more and more patients as this progresses. If it progresses, let's hope it doesn't. If you do the social distancing, we can hopefully put a hold on a lot of the progression of this COVID-19. They're currently going to do temperature testing on all their staff and stuff to watch for people coming in that are possibly sick too. So they're doing everything they can. Sebastian has tested 41 people so far. 36 out of that have been negative, 3 pending, and 2 positives. Out of those 2, neither of them needed to be hospitalized. They were quarantined at home. They weren't symptomatic enough to be in the hospital. And in River, Cleveland Clinic, their total calls to their nurse triage hotline, and that nurse triage hotline is 772-226-4846. And their testing hours are 9 to 5 daily, 7 days a week. So that's open 7 days a week. They have taken a total of 2,750 calls, 2,750 calls to the hotline and tested 507 patients so far. 33 of them have been positive, 238 are negative, and 237 are still pending for the results. So that's it for my report. I'm going to turn it over to Sheriff Darrell Lord.
Thank you, Corey. Thank you, Mr. Brown. Thank you, Miranda. And for our viewers and our listeners out there, I want to comfort you in knowing that relationship that everyone in this room has, professional relationship with respect that we've been through these similar things before, i.e. hurricanes and the like. I can tell you, please be patient with us. Please be comfortable. Know that exactly we know what we're doing. I can assure you of that. As mentioned earlier, as the social distancing continues, we are continuing to seeing that be effective in our community. We certainly enjoy that. And as we look at it from a law enforcement perspective versus the public health perspective, I can tell you, law enforcement wise, we are busy, extremely busy. In fact, more busy in the evening hours than we are in the daytime hours. Cases that we're seeing, unfortunately, include loitering and prowling in the evening hours and the overnight hours, trespassing in the evening hours and the overnight hours. Obviously, domestic violence begins to increase in these types of things. Look, we know that most of you are staying home. There's a few bad apples that aren't staying home. And those are the issues that we're faced with. Of course, our behavioral health, our Baker Acts, again, are up in these trying times for a variety of reasons that most of you could probably figure out. We continue to enforce our DUI laws, obviously, that are on the books, and we will continue to that. The bright news is our inmate population has gone down a tad from 529 last week, this time now to about 480. There is some discretion being used. Some reports are being taken over the telephone and or the internet, but I will assure you that for you, the listeners and the viewers, that you are safe. We have force multipliers on the streets with respect to our deputy sheriffs. We've got deputies that were doing other things, such as the courthouse or in our public schools and other places, charter schools, for example. And that's a force multiplier. And I can tell you we're serious about taking people to jail when they need to go to jail. I'm very, very proud of this community. It's a benevolent community. We've seen this before. We see people sticking together, helping others out in a time of need. So the message today is stay home, social distance, and be calm. I'd be happy to answer any of your questions as well. Yes, ma'am.
Are your deputies, or have you been going to any businesses to ensure that they're complying with the governor's order, specifically craft stores like Joann's Fabrics?
Right. The question was, are we going to any of the schools that were, any of the businesses that were mentioned in the Safer at Home ordinance that the governor placed yesterday that went into effect at midnight. We are working on that and developing a list. There are some stores that aren't what we deem essential. Some of the craft stores have came up, to answer your question. Depending on if they have pack and ship capabilities or other capabilities, those may be, in fact, shut down for a short time.
I did have a question.
Yes, sir.
So for the deputy and the 911 dispatcher that you
Right.
mentioned last week, did you get
Yes,
those
sir.
test results back?
Right, so the question was about our deputy and our 911 operator that were tested last week. We're very proud to say this week their test came back negative. They're both back to work. Makes us very happy that they were able to self-quarantine and get the rest that they needed. And we continue to monitor all of our deputy sheriffs. For example, when our deputies go to a call where there's some type of medical issue, as well as fire and EMS, of course they have their PPE suits, they have their gloves, their masks, and etc. So we have to be very, very careful with that. In addition to that, if anybody is arrested in our county, we have 3 different stations that they go through before they're actually booked into jail. And that's obviously precautionary. Everyone's temperature is taken, both employees as well as inmates that happen to come into our jail. Those inmates will be placed in orientation cells for 14 days if they don't bond out to see how their physical ailment is.
Do you currently have any inmates that are in that quarantine?
Right. Currently, we do not have any inmates that have tested positive. We continue to monitor that. We have a fantastic relationship with our hospitals and our community, as well as fire and EMS. And I do know that fire and EMS have been to the facility. Again, when we have a population that's only 486 as we speak, that's a good thing. That tells me that most people are behaving. And with respect, Colleen, to some of your questions about some of the stores, if we have a situation where this particular enterprise or store, we do not believe that it meets the executive order from the governor, we will warn them. We will advise them about social distancing in some places that actually are open. But more importantly, we're here to educate. We're not here to take a lot of people to jail. But at the end of the day, there's a few bad apples that spoil it for all of us. And that's year-round, to be quite frankly with you.
What's the inmate capacity at the county?
Inmate capacity currently is 711, and as mentioned, we have 486 as we speak. We'll tell you the calls for service at night, I mentioned it earlier, are increasing. I spoke to Mr. Brown earlier today about something that we have to be cognizant of is that as some of our residents pay, unemployment rate goes up and lack of disposable income. Unfortunately, some people try to make up for that in other ways. So I would ask you to be very, very vigilant in your neighborhoods and ask around and see what's happening in our community. You can do that while you're home. You can pick up the phone and call us, and we'll be happy to respond. We have a lot of folks that are seeing something and say something. I'm very proud of that, very proud of this community.
I did have a question for Corey.
Sure.
That's okay.
Sorry, I forgot to ask if anybody had questions. Yes.
So I just want to know if you could repeat those numbers for the test for, I think it was
For Indian River or Sebastian's? Or
Oh,
both?
for both?
Yes.
If you don't mind.
Sebastian did a total of 41 tests.
Okay.
36 were negative, 3 are pending, and 2 were positive. And neither of those 2 had to be hospitalized. And Indian River, you ready?
Yep.
2,750, 2750. Total calls into the triage line, the nurse triage line.
Okay.
Total tested was 507. Total positives were 33. Total negatives were 238. And total pending was 237.
Okay.
Anything else?
Yep, that's it.
All right, thank you.
I do have another question for the sheriff.
Okay.
I know.
Yes, ma'am.
Are you having any issues with people at stores behaving or not?
We have, as most people know, our Walmart in Vero Beach is the busiest call for service place in our county. We continue to have arrests coming out of there for shoplifting. We're trying to regulate the social distancing, as you can imagine, the best we can. I will tell you that some communities have been a little more aggressive in that, in having a certain amount of people enter a store at a certain time. I don't think we're there yet. We'll continue to monitor that. But for the most part, with some of the dynamics that our big box stores have made with seniors and veterans and first responders specific time, I believe that's helped. But overall, the community's reacting very, very well, and most are calm.
So no fights over supplies or anything?
We've had a few, yes, we've had a few where some of our smaller stores that have a variety of things, I guess you call them country stores, where some happen to know when the actual delivery trucks are arriving. How they found that out, I don't know, but sometimes there's a push to get the specific supplies. But we're monitoring that. As I said, with the force multiplier, if you do drive around running your errands, I'm certain that you will see a green and white deputy sheriff there. I think the fire's next.
Good afternoon, Kevin Yelvington, Department of Emergency Services. The Operations Center here is activated in a virtual standpoint at level 2. We're doing 2 conference calls a day just to keep in touch with all of our participants in the EOC electronically, whether through email or conference calls. Unrelated to COVID-19, we did start a burn ban this morning at 8 a.m. That was signed yesterday by Administrator Brown, and that started at 8 o'clock this morning, and then we'll run for a week, and then we'll reevaluate if we need to extend it or if we will maintain it. They've already talked about the Emergency Information Center is operating 7 days a week from 8 to 5. The operators are county employees and otherwise would not be working, such as library and recreation staff. They've answered over 2,300 phone calls in 2 weeks, and that they've been operating. That number again is 772-226-4000. There's been many questions about PPE shortages and such nationwide. We do have those shortages here as well, but we are receiving shipments on a somewhat regular basis. As we've been receiving, we have been distributing out to the first responders, the healthcare facilities, and all those that have made requests through the emergency management section here in Emergency Services. Back to the executive order that was signed by Governor DeSantis, issued for effective at midnight. We're asking all persons in Florida to limit their movements and person interactions outside of their homes to those necessary for essential services and conduct essential activity. That's been stated here previously. For the Emergency Information Call Center, there's other information methods that you can gather that information you may need through the Department of Health, 24/7 at 866-779-6121. Any symptoms of COVID-19, call the Cleveland Clinic Indian River Hospital Nurse Triage line from 9 to 5 daily, 772-226-4846. The Department of Health, Indian River, has a call center as well. They're open 8 to 5 Monday through Friday, 772-794-7411. And also the government website can always be accessed through ircgov.com. And if you want to sign up to get automatic updates, you can go to www.alertindianriver.com, or an easier way to describe it by texting IRC-COVID-19 to 888-777. The Indian River County Government Channel on Channel 27 will have up-to-date information. So that's always a good method for receiving the most up-to-date information that we have. And one other issue about any price gouging that anyone may see, you can call Florida's price gouging hotline at 866-966-7726. Any other questions for any other members there?
I did have a question. So you mentioned shortages. Where are those shortages here locally?
Well, there's just PPP in general,
Oh, just
PPE in general, just like the nation, we're competing to get stuff. We've put in mission requests through the state to help us out with our healthcare facilities, such as the nursing home, the assisted living, the hospitals themselves, first responders, sheriff's office, fire and rescue. You know, we're just anticipating the needs that we may need in the future. and just trying to ramp up for that.
And you get the shipments weekly? For the-
They're sporadic. I
Oh,
mean,
sporadic.
We were notified that they may be here today, or they're tomorrow, and it's just whenever they get here, and we have people on call that can come in and help offload and sort out and then distribute out to where the needs exist.
And can you spell your name for us?
Kevin, K-E-V-I-N, Yelvington, Y-E-L-V-I-N-G-T-O-N.
And what's your title?
I'm Assistant Chief for Emergency Services. Any other questions or comments? Jason, would you like to wrap up? All right, thank you very much for coming, and we'll have another press conference next Friday at 3 p.m.